Welcome to White Clarke Group's first ever webinar. Today we'll discuss customer service at a distance and how lenders are dealing with COVID-19. White Clarke Group is a software provider for automotive, consumer, and equipment finance sectors. Today we have three main speakers: Shim Anand, Executive Vice President of Product and Business Development.
Hello.
Colin Fleischman, Business Development Director.
Hello.
And finally, our guest speaker, medical professional Andrea Lischuk.
Hi, everyone.
So the agenda for today will cover the following: digital human interactions and how to make the most of your people working remotely, how businesses are adjusting to COVID-19 in terms of logistical and infrastructure requirements, a look at how business will function beyond the pandemic and what can help your business to thrive, and finally, a medical perspective from a health professional about what the background, current state, and the future of the pandemic will hold. We will have a question and answer period at the end of the webinar. We do ask, if you have any questions, please comment in the chat below and we'll be sure to answer as many as possible at the end of the session. My name is Sabrina Phillips and I'll be moderating today's webinar. We'll start by discussing how businesses are adjusting to remote work. To start us off, Shim, can you please share what you've seen from the technology perspective?
Sure. There's a couple of areas that we can talk about here. We'll start with the most obvious, remote capability. So a lot of companies were 100% remote capable already, and they had a fairly easy time adjusting to this situation. And some were a little bit closer to zero, and they've had a very difficult time adjusting to this situation. And most companies felt somewhere in between. Some of the less prepared companies that I'm familiar with had to scramble for quite a few weeks, and some of them are in fact still scrambling today because they weren't remote enabled already. Even simple things like just giving all of your employees laptops instead of desktops makes a big difference if you quickly need to send them home for something like this. We had an interesting anecdote from one of our clients where they actually had to get some of their employees to take their physical desktop boxes home along with their monitors and some of the other accessories because they just weren't set up for remote work, but they did what they had to get set up. And then, of course, the business continuity planning that most companies do was actually tested. So at this point, we should all be familiar with how good our business continuity plans are. If it was good, then we were able to get up and running pretty quickly. And if it wasn't great, then of course we have some improvements to make. Another interesting area has been the tools that some of us are using. So there's several obvious ones from a communication and collaboration perspective. Things like MS Teams and Slack for chats and IMs, video conferencing tools like this one. I think Zoom's become really popular right now, and we will talk about that one in a little bit from a security perspective. Skype, Slack, etc. And for companies that are not already set up with those video conferencing tools, some of their employees are just doing whatever they have to get their work done. So they're using personal applications like WhatsApp and even Houseparty to do work. I'm actually aware of some people who are using Houseparty to get work done. From a document sharing perspective, obvious things like Microsoft SharePoint and Dropbox are commonly used. It's nice that those tools are in the cloud, because one of the biggest challenges that we've seen some companies face is when your tools are not in the cloud, and now suddenly you're having to give your employees access to them when they're not in the office. It makes things much more difficult. And even something as simple as being previously set up to forward your business phones to your home phone or your cell phone, if that was already set up, then you're able to keep communicating with people quickly, and if it wasn't, then you're having some difficulties. And finally, from a White Clarke perspective, we were already remote capable. We're a technology company. That's a part of our DNA. We've, of course, never had 100% of our employees working remotely at the same time. So that required a little bit of an adjustment, but we were able to get through it pretty quickly. And I'm happy to say that our business continuity planning has proven to be successful.
So, Colin, what are the risks associated with the rapid technological changes that companies are implementing during COVID-19?
Thanks, Sabrina. I think flexibility has been key to what everyone's implementing. From the perspective, it's not always about building resilience, but having the flexibility. And unfortunately, all this does have some risks. The first is from a usability perspective, ease of use in the tools. is very, very important. Making it easy for people to still communicate, still to work, and easy to implement. Because in most cases, we didn't have weeks to go and train all the employees of the company. Secondly, is reliability, which not just for internal communication, but probably most importantly from a customer service perspective, making sure that the tools are reliable enough that we have contiguous conversations and not things dropping out in the middle of conversations that make it more frustrating. Security, though, has had its issues with this pandemic. Even if we look at the rapid ontake of things like Zoom has had its issues, especially around security and confidentiality. Lots of accounts and data has been lost or released out into the public. So here, it's not just about the security and the tools, but also the ongoing training and the awareness that sits behind that. Not everything's going to be 100% okay on day one, but learning and keeping on top of it has been very important for both ourselves and our customers. And lastly, I think, some of the risk is also ensuring that we still protect our employees. It's just as important as servicing the customer and protecting the needs. We also need to protect our own employees from this. So regular reviews, sharing of experiences, learning as we go, and implementing, policies and changes dynamically, sometimes on an hourly or daily basis, is very important.
Yeah, I'll jump in a little bit there as well, actually. And with the adoption of all of these video conferencing tools, it's not just security that's a concern, but for some larger companies like banks and some of the larger captive lenders, we've also seen that compliance has been a concern as well. I'm aware of one scenario where even though some financial advisors or employees are enabled to do video conferencing, the institution required that these calls be recorded and then stored for 30 days. So they're not able to do that portion of it yet, which is why they're not able to video conference with their customers yet. So even if a company is technologically ready to do this, they might have to get through some internal compliance requirements before they can truly start using some of these tools going forward.
Thanks for that, Shin. Colin, how has communication and culture changed based on COVID-19?
I think everyone can agree that communication and culture has changed significantly. I think the things that we're seeing mostly is communication has actually become a little bit less formal and more open. We have to be flexible and work within the challenges that we have. I think to ensure correct understanding, communication is about understanding as well as communicating. And people are therefore being maybe more careful and accepting of how things are being said, sometimes in quite a non-professional setting, because we're no longer working in our offices and place of work, but in a home situation that is far more challenging. Things such as techniques of repetition of conversations and ensuring people correctly understand what is being said is forming a major part. And at the end of that, we're accepting a blending, both that personal space, work life, pets, children, all of that together into our work lives, and in some way making it a little bit more interesting. On a customer service perspective, we're seeing multiple methods being used to get the job done. Obviously, the combination of voice and sometimes often sharing emails and screens as becoming the way to do things, instead of often maybe waiting for a response from a person in email. People are saying, quickly type the email now, I'll wait until I receive it, and then we can respond and close down the query or the issue or what's being asked. So in the same way that that's being said, especially in our industry, lenders are getting to know their customers better. It's also creating a more personal interaction between them, and therefore also seeing how they adapt to texting, emails as well, maybe instead of voice. We're certainly seeing the adoption of technology helping out, the expansion of services such as e-signature, self-serve capabilities are now being accelerated. Many of our customers who may have had those options within their current technology stack are now pushing that as an enabler for service. On the other side, whilst it's challenging, service providers also need to be conscious of not generating too much noise and still maintaining, I suppose, the legal compliance of not contacting a customer 10 times in a day, be it by voice or by email, and allowing things to, work naturally as opposed to, the ways that we've been used to. On the other side, connection is changing. From a cultural perspective, not only are our staff probably becoming more connected, learning a little bit more about each other because we're remote, but the focus on also establishing a larger connection with customers has been important. And we see a lot of that through organizations publishing information on social media, as well as the way the staff interact with the customers and also between companies. Jim, what are we seeing from our customers' adoption of video as a communication tool? How is that changing the way we operate?
I find that part pretty interesting. Obviously, if we were going through this 10, 15 years ago, it would have been very different than the way we're going through it today. People are already quite used to video chatting, FaceTime, WhatsApp, Facebook Messenger, etc. And then from a work perspective, I think people are comfortable with video conferencing with their colleagues. We use this internally at White Clarke all the time. That's become the default mode of communication now. Some are doing this with customers, depending on, of course, our customers' comfort with coming on video, but we typically try to stay on video when we're having video calls with them. And what's interesting is that it's still unfamiliar with strangers. So if we're speaking to a prospective customer or someone we personally don't know, then it's a little bit weird, right? So if I were to speak to my doctor or my lawyer or my financial advisor or anyone else that I need to talk to over the video, if I already have a previously established relationship with them, then it's a lot easier. But it's still a bit weird if you do it with someone that you absolutely have never met. But I also think that'll become pretty common. If you think back to a long, long time ago, when the first time you got into someone else's car, when you ordered an Uber X ride, or the first time you stayed in someone else's house through Airbnb, it was a bit weird, but now it's normal. Similarly, I think video chatting with strangers will also become pretty normal, especially now that we're accelerating that.
Yeah, thanks, Jim. I think also from a White Clarke perspective, this has changed some of the things we do. From a business as usual perspective, we were always an interconnected group of people locally using collaboration tools, video and chat and email and all the technology we have has always been there and enabled us to work remotely, be it on customer side, from home, in an airport, wherever. But we have seen some certain things change in the last few weeks that are important. There is particularly a larger workload on the senior people, our project managers and coordinators to manage interactions. It's not always about checking up that people are actually doing the work, but from a more HR perspective, making sure that they are okay. And I think in our day-to-day conversations, even with customers, that question of are you okay and is everything all right, a far more personal interaction. From overall, I think everyone's working closer with the HR departments, making sure the well-being of everyone is being looked after, and trying to keep in touch in different ways. And overall, I think there's a higher discipline across everyone. Everyone's stepped up to the plate, especially when it comes to meeting attendance, meeting deadlines, or just performing work in general. So I think from a collaboration perspective, we're seeing benefit. But these are the challenges that every business will be facing.
Thanks, Colin. Shim, do you have any interesting insights, though, from the people that you've worked with?
Couple of points worth noting, I guess. Some of the more obvious ones are that there's just a greater focus on community service right now than we've ever seen before, which is really nice to see. You've, of course, seen all of the stories in the news and social media, but just even from some of my colleagues and some of my friends, there's a great belief and drive to volunteer to deliver food to people who are either immobile or immunocompromised. Some of us are participating in personal protective equipment drives for healthcare workers. As we know, there's a shortage of that in some areas. And I want to expand on a point that Colin made earlier on about well-being. So we've got a greater focus on employee well-being, just because this is not standard remote work. This is a different kind of remote work. We're cooped up for week 6, I think it is now, in North America. So there's a greater focus on enabling employees to do things together, like virtual happy hours, playing games, socializing. We've set up some meditation. And I do want to touch on the point that Colin made earlier on about the regular check-ins with your colleagues and your employees. When you're in the office together, you can see someone's face and you know if they're doing okay or not. But since you don't do that, you can't see their face regularly right now. It is important to check in with people regularly.
Thanks, Jim. I think, just supplementing that, we're also seeing new skills, or maybe those hidden skills that have been part of our workforce, as well as new ideas. So just like, with the PPE drives and the volunteering, etc., we're seeing people step up to the plate to offer assistance in many different ways, be it information they may know, faster ways of doing things, easier ways of doing things, and mostly, I think, from the support of colleagues. Everyone's coming together as a much stronger team, I think, through this crisis. People also taking on work and opportunities maybe not typically in their role or scope of work to try and help ease the workload and bring together results faster and more effectively. A lot more people are taking on the task of just training and supporting others, and I suppose we can sum that up as teamwork, but it's really been extraordinary in many areas. And lastly, I think one that's really interesting, some of the quiet achievers, maybe those that don't feel as happy, to stand up in a meeting and ask a question or lead, a session. They are, now leading face-to-face conversations in the virtual session. So we're seeing great support from all the people, and especially the skills that we didn't see before coming to the fore.
Thanks, Colin. So now we can move on to our next topic. Other than working remotely from home, what are some changes we're seeing in the industry perspective? How are customers and even White Clarke Group adjusting to the COVID landscape?
I'll start with that one, I guess. There's a huge impact, obviously. All of our primary customer sectors, be it the auto finance, asset finance, or consumer lenders, are obviously having a lot of difficulties right now. And I'd say our automotive customers are probably facing the biggest challenge at the moment. You can just watch the news or read anything every day to understand the magnitude of the challenge that they face. There's two areas that we can look at from a tactical response perspective, and then just strategically how they come out on the other side of this. Our lenders already prioritize the ability to make changes quickly to respond to market conditions. So, changing credit policy or pricing or plans and packages and incentives, etc. They're using some of that functionality to make those changes right now in response to the market conditions. From an automotive perspective, obviously the incentives in those plans have changed a lot. A lot of lenders are now doing payment deferrals for 6 months, finance a car. They're being a lot more flexible with grace periods and allowing people to skip payments if required. And then from a consumer finance perspective, it's been a little bit more interesting. We've got a couple of interesting stories to share there. So one of our lenders implemented a policy at their branches for social distancing, where only one employee works in a branch at any one time, and they can only speak to one customer at any one time. So the bank branch, the lender's branches had lineups outside, just like most places did. And they were able to use this and still continue serving their customers, depending on the area that they're in, assuming that they're still allowed to be open. One of our other lenders actually set up tables outside in the parking lots so that they could still process the same volume of customers and still, enforce social distancing. And then for some of our consumer lenders, they typically push incentive plans once or twice a year. They're actually pushing that now on a permanent basis in order to make up for some of the lost volume from the situation that we find ourselves in right now. And then from a technology perspective, our lenders are requesting features that are facilitating remote origination and servicing of loans, obviously. So from a point of sale perspective, there's less customers at dealerships and branches. And so we need a way to bring in more applications. It doesn't matter what sector you're in. So they're working with aggregators to increase the application volume that's coming in from either the web or from mobile apps. From an underwriting perspective, we're big advocates of automation, and they're requesting some more automation at the moment. And it's been interesting to actually watch some of them use their existing features in our toolkit to modify their credit policy, to buy deals that are less risky right now, and tighten their lending policy, and even modify the pricing almost on a daily basis if they want to, in order to respond to the current market conditions. From the funding side of things, e-signatures are bigger than they ever were before. They're a must-have now, if they were a nice-to-have before. And automated verifications are also becoming a bigger thing right now, because even if you wanted to make phone calls and verify information about some of your borrowers, that's a lot more difficult under the current conditions. It's more difficult to get a hold of people. So if you can do that automatically, you're saving yourself some time.
Great, thanks, Jim. I think we're seeing some other things as well happen in the industry. One is obviously from that servicing or the back office operations, customer service is still key. Knowing your customer, knowing the situation is important. At the same time, due to the volumes and the working from home challenge, customer self-serve has really come in to help reduce that workload. Giving the customer more automated control has been the focus. On the other side, where customers may not be doing everything themselves, the workflow aspects of the solutions out there need to be managing that customer service, making sure they're managed so at least the customer is being looked after, but at the same time, we're still compliant in recording and managing those requests and changes effectively. One thing we're definitely seeing is changes maybe in credit behavior and policy, especially rewarding good behavior from customers, maybe waiving fees where they have been charged, etc., to keep the customer and to help them along. I think from the payment side, electronic payments have really sprung up and are now really the preferred method of doing everything. No one can go to the bank to deposit money or to a branch, etc. So electronic payments really being the fore there. And from the funder or the lender's perspective, the flexibility in enabling restructuring of contracts or promise to pay arrangements, those type of things, coupled with probably easier and flexible grace periods today are where it's coming. One of those areas that's probably a little bit forgotten, but today is really proving to be a valuable asset, is the ability to report using data from systems, be they within the system or being put into data warehouses. Our customers are now looking at that to manage their risk and to see where the challenges are, using that data to identify where they should focus their resources and also where they should change their risk management strategies.
Thanks for the insight, Colin. But can you address what White Clarke Group is doing for those changes?
Thanks. This is a very important question to ask and a very important one for us as a business. Client support for us is always our highest priority. For us to maintain service levels with minimal issues is always a key. So being a technology company and using the same technology that we've always used has made that transition very easy for us, and probably easier than most. It's something that our clients were always expecting. And whilst we always, have the challenges when we write contracts with our clients, etc., especially when we come to areas such as regular audits of our BCP or disaster recovery policies, I don't think we ever thought that there'd really be a day where we'd really test them to the full extent. And now that we have, it's great to see that all that hard work that went into that has paid off, and we continue to supply the levels of support and attention to our customers as though nothing had changed. From a new business opportunity perspective, this has definitely changed. Today, we're doing more video calls. We're not traveling to the airports and staying in hotels. The conference call has become the mode of operation for us. And in many ways, we're working closer with our customers, being very careful how we do business, still maintaining data security, video security, technical security, and really focusing on what capabilities are crucial has changed. So we're working with our customers to help them train their existing staff on how to restructure deals, offer payment arrangements, helping them maybe change configurations to allow more flexible credit options. Tim, what else are you finding there?
A couple of other points worth mentioning. I think we'll take the opportunity to review our delivery model to make that more efficient. And we'll also continue investing in product improvements. There's a lot of cool stuff that we're doing right now with microservices, Swagger, and Technically. So if there is an opportunity, and there is right now, we will accelerate some of that work so that when we come out on the other side of this, we're ready to take on some of that pent-up demand that our customers will have, and we can accommodate them.
Okay, thanks for that. I think we should move on to our next topic on what business will look like after COVID-19. Shim, to start us off, how do you see our industry changing after COVID-19?
It's going to be really interesting. Don't have a crystal ball, but I suspect that we'll see an acceleration of existing trends. So we're already heavily focused on automation, being digital, letting the customers do things without having to physically come into a location of some sort. So I think we'll see an acceleration of those trends. So consumer expectations will shift further. And I do think that lenders who can't keep up with those expectations will fall behind. Take the simple example of outside of our industry of telemedicine. So the medical professionals weren't really great at doing video chats like this, but I am able to do a video chat with my doctor right now. So even after this is all over, unless we need a lab test or a physical, I really don't see why I should have to go into their office or their clinic. Similarly, with anything else that we're dealing with, whether it's branch-based consumer lending or dealerships for cars, as the restrictions for COVID-19 are eased gradually, just like they were put in gradually, even if customers are allowed to go to your branch or your dealership, I don't think they're necessarily going to do this because A, it won't feel safe, and B, their expectations have also changed from a technology perspective. So businesses that adopt to this new reality quickly, I think will be able to benefit from when we eventually start slowly getting back to normal. A great example of that is CarMax, the US used car behemoth. They've started offering a CarMax curbside pickup service. So even during these times, they've been innovative, and they're allowing their customers to come and pick up a car without interacting with another human. So from an automotive perspective, I think the end-to-end digital car buying experience will become the new norm. There's some companies that already do this, like Carvana. You can pick your car and it's shipped right to your driveway, and you don't have to talk to anybody, and you don't have to go anywhere to do that. Some customers will always prefer buying cars from in person from a dealership with the test drives and the experience, of course. I don't think that's going to go away 100%. But a lot of them will prefer not to spend time at the dealership at all. That transition was already in progress before this, but I think this is going to accelerate that. Then from a consumer perspective, honestly, just again, end-to-end digital experience. So apply for the loan online, get the loan online, get it deposited into your bank account without having to walk into the branch. And then a lot of our consumer lenders rely on repeat business, so also making it easy for their customers to renew or refinance their loans without having to physically come in, I think will be a big sell. From a business travel perspective, Colin had mentioned it earlier on, we're not doing that right now, even when things get back to normal. A lot of our businesses have, of course, suffered. So we'll be looking at the cost. Do we really want to do it as much as we used to? We'll be looking at the risk. Okay, it's allowed again, but do we want to put our employees at risk? And then different expectations. Hey, we did video conferencing and it worked fine. So do we always need to meet in person? Virtual might be okay now.
Thanks, Shim, for that. Colin, what about the asset finance sector?
Yeah, I think the asset finance sector is getting a lot of feedback and input, obviously, from the other sectors. But the one that's really showing at the moment is the concept of digital marketplace. Not everyone's used to that from an Amazon or that type of thing to go buy an asset, but really linking that digital marketplace with a finance offering is where some of the big changes are coming. And maybe this comes from, what will the sales point or the showroom look like after this crisis? Are we looking at smaller showrooms? We're certainly seeing that in some of the businesses we're working with. They're looking at shrinking the footprint there. as well as, working closer with that direct link to finance is going to change the way that we sell items. Most of that, though, is being governed by interconnectivity. The need, just as we are human, to interact with each other, businesses are going to need to work far closer to overcome these challenges that we face today. I think the collaboration there is going to become greater. We've certainly seen it in some industries, example, Ford and Volkswagen collaborating on electric vehicles. Who would have thought? But I think in asset finance, we're going to see a lot of collaboration between both the manufacturers of the assets, the people providing the service, maintenance, consumables, as well as finance. Maybe that triangle is going to get a lot closer. And I suppose, at the end of the day, it's supporting all of that is going to be a big challenge. And really providing the frameworks of the technology to allow everyone to interact together and provide the best customer experience at the end of the day is going to be where the biggest changes happen.
Vic, can you expand on what our customers are experiencing?
Thanks. I think from a customer perspective, the lender's employees, I think, are doing today more customer relations work than probably the originations work, especially at the moment while we're transitioning, seeing how things will look, when will things be over, how do we resume a more normal flow during the business cycle. They're refocusing the priorities. So a lot of them are now looking at how do they strategically come out on top over the COVID-19 crisis is over? How do they maximize the opportunity for their business and maintain a profitable business as well? On the other side, when we look at maybe what we're doing, which would be very similar to many of our customers, is an investment in research and development, in our innovation projects, to keep not only the White Clarke Group products, but our customers will also want to keep their products at the leading edge of whatever their clients need.
Yeah, I think I can add to that a little bit there as well from the White Clarke perspective, Colin. From a remote perspective, we're already digital, of course, but there's some interesting areas to explore. Do we really need desks for everyone? Should a part of the workforce be remote? Do we implement hot desking? There are companies out there that do this today. It's just not something we were doing on a regular basis. And then, as you've mentioned, working with our customers to recalibrate their priorities based on the current needs. So obviously, everyone's plans for 2020 have now been thrown away, and we're making new plans. And some of our customers are already planning for what's going to happen in the second half of this year as things gradually return to normal. So we're working with them to be ready for that when their spike in demand goes up in the latter half of this year.
Okay, perfect. Thank you to Shim and Colin for this great discussion. We'll now hear from our medical professional, Andrea Laschuk, who will provide us with some insights on COVID-19 from a medical perspective. So Andrea, over to you.
Okay, so sorry, hello everyone. I'm just gonna show my screen, right? Yeah, okay, here we go. Everyone, hopefully can see this. So I'm very happy to be here today. Thank you for having me, and thanks for the introduction, Sabrina. We have a pretty jam-packed agenda, so I'd like to just get into it, provide you with some background, help you understand some of the statistics out there, and hopefully provide some insight in planning going forward. So the coronavirus are part of it's a group of related viruses that cause infection in mammals, and in humans, they cause respiratory tract infections that range from mild, which make up the common cold, to lethal, and I'm sure you've heard of SARS, MERS, and now we're dealing with COVID-19. With respect to transmission, it's spread through contaminated respiratory droplets. So a good thing to keep in mind is anywhere that a droplet could fall from a sneeze, cough, or from saliva, you should be assuming that if you are infected, that the virus is present. The severity tends to range. So to date, we know that 80% of confirmed cases are either mild to moderate in severity, and this 80% includes asymptomatic positive COVID-19 cases. The other 20%, that's the 20% we're quite worried about, which are the ones that are seeking medical attention and going to the hospitals. So we have that subdivided into a 14% group that has a severe presentation, which may require oxygen, supplemental and supportive care, and the 6% are deemed critical. So those are patients that are intubated and are in more of a dire state. For your knowledge, I'm sure you're aware, but typical presentations are flu-like, but there are some symptoms that seem to be more related to COVID-19, and that would be anosmia, which is a loss of smell. Some patients have gastrointestinal issues like diarrhea, and there are some emergent cases of skin conditions. I do want to point out the presentation timeline. One of the reasons that this virus is so contagious is the fact that there has been documented asymptomatic transmission. So we have quite a long incubation period of, that can go up to 2 weeks, where people are shedding the virus but are not displaying any symptoms. And typically it appears that the time from presentation of symptoms to hospital admission is about a week, and then things may progress accordingly for that 20% of the patient population. Really, we're worried about risk factors that can lead to a poor outcome. This is that 20% that I mentioned. Evidence is emerging, but it seems that in general, the patients that are positive for COVID-19 that display the poorest outcomes are those that are older, so 65 and over, have some sort of underlying chronic condition, and potentially have a compromised immune system. And recently, data has shown that the majority of those that are hospitalized tend to have a higher BMI, tend to be overweight. So that's definitely something to be mindful of. There's a lot of measures in place, and really I want to provide some background as to why they're in place. We're trying to prevent the transmission of the virus, really to protect that 20%. We want to make sure that those that are asymptomatic are not spreading it to that high-risk population. And really the aim of all of these collective measures are to protect the vulnerable population and really ensure that the integrity of the healthcare system is maintained. We're trying to limit the spread and until there's a definite measure in place, like a vaccine or a proven treatment option. Really getting into the statistics, I mean, the numbers can seem a bit daunting at times. So as of this morning, we have just under 2.7 million confirmed COVID-19 cases globally. And of those confirmed cases to date, 185,000 have passed. So really the fatality rate of about 7%, that can be a quite a scary number. And we see that over the past several months, our cases have been exponentially growing. So really, there's a lot of talk about flattening the curve. Are the measures that we've put in place, are they making a difference? So our world in data has a great data aggregation that displays it, really to demonstrate if countries are doing well and what the current state is. So just to give you a little bit of background, the statistics that are being tracked and compiled are really enabling us to track the progression of the disease. They provide background information for data modeling and really enable us to predict future measures as the pandemic evolves. We unfortunately will not know the true impact of the virus until it has passed. Yeah, so that's why these measures are quite important. So we can see here on this this graph that the European countries are flattening, so they've surpassed their peak, while in North and South America are gradually increasing in the daily confirmed deaths. But what does this data mean? Like, what do these numbers actually provide us? So right now, that 7% fatality rate is actually the case fatality rate, which measures the disease severity. Really, it's just a simple division of the total number of deaths from COVID-19 over the total number of confirmed cases. So there's a couple problems with looking at this number at face value, because really our denominator is not a true denominator. So a better measure would be something like the infection fatality rate, which is really the probability of death if you acquire the infection, but we will not know that until the pandemic has passed. So right now we're looking at the case fatality rate as an estimate. So you can see here that as of today, these are the general trends of COVID-19 in these countries that I've included. So overall, the countries that were deemed hotspots for the virus, like Italy, Spain, are plateauing in, but their case fatality rate is increasing. And other countries are gradually or steadily increasing, like the United States and Canada. So as I mentioned, the denominator is not the most reliable denominator to date, because the testing per capita is reported differently across countries. For example, the United States has mixed positive cases with positive tests. So a case would represent a patient. In Canada, we have patients that are in the ICU that during their entire stay, which can be several weeks, over a month, they receive multiple tests to see if they're recovered. So in some of the states in the United States, something like this would count as multiple positive aggregate in the total value. So because there's inconsistencies across the countries, and that makes it quite difficult for us to interpret the case fatality rate. But you can see that over the past 2 months, testing per 1,000 people has increased, which is a positive sign. The more tests that we have, the more meaningful our denominator becomes. So, I do want to say that a gold standard was South Korea, because they looked at cases, so the number of infected patients, and they did begin testing quite early. So I've put together a couple of resources, but feel free to ask me any questions, or definitely provide some of these offline, just for the interest of time. But I wanted to spend the majority of the presentation looking forward and really establishing what we should be doing. I've divided my suggestions into 5 categories, and these are actually influencing our current state to date. So the most important measure that I would like to emphasize is that we should be following local government direction. We need to keep current on our local trends, even our global trends, just to kind of predict measures, and be cognizant of what the government is imposing for us. We want to be aware of their direction, timelines, projections, and advice, and we need to start locally, because the virus trends differently across other countries. So it's had different impacts in different countries because of decisions made. We want to continue promoting containment measures. So we want to follow distancing guidelines. It's so important in protecting ourselves as well as the vulnerable population. And testing is such an important aspect of getting valuable data and enabling those that require care to be cared for appropriately. We want to await for broad serology or antibody testing because and that data will come as the tests are approved and distributed and more people recover. And this may shed light on those who are able to return to work if immunity is established. Contact tracing is so important. We need to ensure this, and that's really one of the reasons that countries like South Korea had such a good early response. Those that were infected and potentially infected others were practicing distancing measures and isolating appropriately. So it's a great thing to continue. We really need to wait for evidence-based treatment options. There are multiple drug trials that are being conducted right now. And hopefully over the next several months, they can shed some light on potential treatment options. It's so important to follow government direction until proven efficacy of agents is established. Medications come with a variety of adverse side effects and risks. So it's crucial that these risks are appropriately assessed prior to mass acceptance and recommendations, because and these drug trials unfortunately take time, and there's processes in place to ensure validity. So we need to ensure that is the case. Really, the main treatment and method to eradicate a virus is a vaccine. So vaccine development, I'm sure you're aware, it is quite a lengthy process from genome sequencing to development of a possible vaccine to even approval after testing. So we've the general direction has been to detail a length of time to get a vaccine to be like 12 to 18 months. But I mean, also factor in the time it takes to produce the vaccine in a mass quantities and to distribute it. So as a reference, in 2003, the SARS vaccine took about 20 months to develop. So, to shed light on this, it is there is a lot of collaboration, and it seems that things are moving, but it's good to set expectations this way. I've included this slide because it's quite interesting. This virus has different viability on different surfaces, so it's something to keep in mind when considering disinfecting your personal or work or your workspace, and really for future planning, just because the virus is quite contagious. So for future planning and considerations to return to work, I've a lot of companies are asking what measures to take to limit the spread of the virus within their workplace to protect their employees, protect their customers. And I've kind of subdivided into two main guiding categories. We have government directed policy, as well as using transmission principles to make these decisions. So as I've mentioned before, we need to mirror local government direction. That's the most reliable and most pertinent way to start. Going forward, we may be required to have proof of a negative COVID-19 test or have positive serology to return to work. Only time will tell, and the government may look to issue specific immunity IDs, and there may be policies in place to ensure to enable risk stratifying employees. So those that are high risk continue to work from home or continue to be isolated, and those that are deemed to be a lower risk can return to the workplace. Another potential requirement may be that workplaces need to have measures in place to screen people entering the site. So something as simple as taking a temperature, or maybe a pinprick point of care test that provides quick serology really should be considered at the moment. And the other aspect of this, the other category, is transmission principles. So really, once we return to the workplace, because as was mentioned earlier, these restrictions were put into place gradually, and they will be lifted gradually as we learn more about the virus and as treatment options become available. So we should be ensuring that within the workplace we have appropriate measures. So personal protective equipment like masks, gloves, sanitation like wipes, decontamination wipes, or a hand sanitizer, really in promoting those distancing measures, and potentially even having tiered teams. So dividing the groups of people so that some go to the office and some stay at home, so that if somebody does become infected, contact tracing is more doable. And we really want to consider minimizing the number of employees in a meeting room if meetings are to return as previous, if virtual meetings are not an option. So if in-person meetings are required, then considering maybe not using the same meeting room until decontamination has occurred successfully. So, I want to leave you all now with just saying that, a lot of work is being is currently undergoing for this pandemic, and it really is a perfect time to start developing contingency plans and have these measures in place once we do return to work. Thank you so much, and I look forward to your questions.
Okay, perfect. Thank you so much, Andrea, for the presentation. We're now going to go into the question and answer portion of the webinar. If you haven't already done so, please send your questions to us and we'll be sure to answer them. So first, have a business question for Colin and Shim. Some of the effects we are seeing is that we can now operate in a much lower cost base. For example, office rental space and less travel costs. Do you guys see that going back to the old way?
I guess I'll get started. Not 100%, no. As I mentioned earlier on during our piece, I don't see it going back 100% to where it was before. We will return to some of it, but I actually think that when companies are planning on expanding their workforce in the future, office space is a significant cost. And as this crisis has proven, you don't necessarily need it 100%. And if you're interested, you can check out a couple of articles on companies that are 100% remote and how they manage to do that. So it's definitely not going to go back to exactly the way it was before. That doesn't mean it's also going to go 100% virtual. There is nothing like face-to-face human interaction. I know we all miss it right now. And especially when you're trying to do new business deals, that face-to-face interaction will be key and critical. But whereas you might have traveled 5 times before, you might not now do it 4 times virtually and once in person to seal the deal.
Yeah, thanks, Jim. I totally agree with that. I think we're not going to go back to exactly what it was, and we're not going to swing the other way. Quite often when businesses are looking at strategies for being online or virtual, they tend to do a lot of market research and enter it tentatively. Now we've got a case where actually all that market research is being done or forced upon us. We're having to work remotely. So we can look at a lot of insights from this and then establish policies in a direction going forward. That means maybe we can be more effective, smaller floor space, maybe less contact, maybe less travel. But I think that'll be on a case-by-case basis.
Okay, perfect. And Andrea, we have a health-related one. Do you think mobile tracking software adds any value when the virus can live outside a host for somewhere between 24 to 48 hours?
So just to clarify, tracking, what are we tracking? Just how people are moving around, or?
I think, yeah, it's how people are just traveling around, and I believe it's how long it lives on a host or on the outside of a host.
So there is a transmission from touching, I guess touching a host, but really I think the benefit of mobile tracking is for contact tracing, so that in that time that a person doesn't know that they're infectious, then develop symptoms, are tested, have a positive test, then that data can be looked at over a period of time, and those people that may have come into contact with this infected person can be contacted, traced, tested and isolated, so that further infection is not continued. So I do think it's beneficial. Yeah.
Thanks. Back to Colin and Shim for a business question. What kind of strategies do you think captive finance are putting in for originating and servicing more? And what sort of products might they focus on?
I think maybe from a strategy perspective, people need to start looking at what are the products that the customers are demanding. As we move into crisis like this, is long-term products where the business needs to go. And I think that will vary between industry. As you look at the auto market today, we're not selling cars today, so maybe shorter-term rental products, ability to swap them, on a more frequent basis is where to go. In asset finance, maybe part of that industry needs to look at longer term, to secure the assets, or some maybe shorter. I think people will have to look at this from a risk perspective and then see where are the customers demanding, the changes in product. As for the ideal product, I think that's going to be a combination of what the customer needs, the risk profile that the financier wants, and secondly, the underlying funding structures that will be in place.
Okay, perfect. And Andrea, another difficult one. You said to wait for vaccine development. What if a vaccine isn't found?
That is not an ideal situation, because then we rely on something called herd immunity, which would require a significant percentage of the population to have acquired the vaccine and become immune. But to date, we don't know if there is lasting immunity. So there have been some documented cases of reinfection. Right now, there's a lot of confounding factors where they brought in from another country. Was it a different strain of the virus? Did it mutate? There's a lot of unknowns, unfortunately, but that would not be the ideal situation that we want to be faced with in a year.
Okay, perfect. And our last question for Colin and Shim. The lens through which value is determined has changed. Has it changed permanently, or will it revert once the pandemic comes to an end? If so, what may the new normal look like in respect to the customer or the client-lender relationship?
Oh, that's a good one. I do think that has changed permanently, and Colin, please feel free to disagree. But right now, if I'm a borrower, I'm going to be very happy with my lender if they've made it easier for me during this very, very difficult time with repayments, with repossessions, with any of the typical scenarios that you encounter when a borrower is having payment difficulties. So the value may have originally come from, I like your rates and I like the cars you sell. But after this, it may come from, I trust you now because you did your best to make my life easier during a time of crisis. So I think that's going to change significantly.
I tend to agree with you, Shim. I think the value here is that customer business relationship. Maintaining that long term is going to be key for both word of mouth marketing, trust, and also belief in where people will find funding, where they will finance their assets or automotive requirements, And at the end of the day, those that succeed in managing people through challenging times, I think will be far better off than those that just try to recoup financial value on day one.
And yeah, just to add to what Colin said there, Sabrina, did you take care of your customers and enforce social distancing and implement cleaning and disinfection policies like the ones Andrea was mentioning because you thought that was the right thing to do, or did you only do it because someone made you do it? People are going to remember.
True. Okay, everyone, we're going to have to conclude the webinar here. Thank you so much to everyone who is tuning in, and we hope that you've gained some valuable insights. We'll be sending out a follow-up email for your feedback and input, and if you'd like to see other topics discussed in future webinars, please let us know. Thanks, everyone.
Thank you.
Thank you, everybody.
Bye.